powder inhaler for the first time will need to be instructed in its safe use. Introduce yourself to the patient.
My name is Jessica. I'm going to be your nurse today, okay? I'm just going to wash my hands.
All right.
Perform hand hygiene and ensure privacy. Verify the patient's identity using 2 identifiers.
Can you tell me your name and birthday, please?
Warren Hildebrand, 4/5 of 68.
Okay.
Compare the label on the medication with the information in the medication administration record twice when preparing for administration. Do a 3rd check at the bedside. Also check the expiration date of the medication. The inhaler is a handheld device that delivers a measured dose of medication to the airways. A dry powder inhaler, or DPI, delivers this medication as a fine powder rather than an aerosol or mist.
Okay, first thing I'm going to do is take a listen to your lungs before we do the inhaler, okay?
Okay.
Just take some nice, slow, deep breaths for me, okay?
Assess the patient's respirations and breath sounds. Ask him about his subjective symptoms, such as shortness of breath. As you proceed, keep in mind the 6 rights of medication administration. For a quick review, see the video skill, ensuring the 6 rights of medication administration.
Good, you can relax. Okay, the dry powder inhaler, they just loads 1 dose at a time, okay? You slide it down like this, and then you have this trigger that actually releases the medicine.
Discuss with your patient why the medication is being given and explain how a DPI works. Explain that you will use a training device to teach him how to safely use the device.
Okay, I'm going to help you to the side of the bed here. There you go, all the way, feet on the floor. Good.
Caution him not to use the inhaler more often than the healthcare provider has ordered, and advise him to be alert for possible side effects. Then determine his ability to hold, manipulate, and activate the DPI. Point out the external counter that indicates the remaining number of doses. Demonstrate how the device works, then hand it to the patient and talk him through the steps. Some units require rotating a lever or inserting a capsule or disc into the device. Always follow the manufacturer's instructions for the specific DPI you're using.
Don't ever use it more or less than what your doctor prescribes for you. Okay, we're going to practice with this trainer. Okay, I'm going to show you how to do it first, and then I'm going to have you demonstrate for me. I'm going to open it like we did before. Load the dose. Breathe all the way out. So, breathe in. Hold for 10 seconds, mouth closed. And then you're going to breathe out through pursed lips. So, okay, so breathe in, hold for 10 seconds, out through pursed lips. Okay? Here you go.
Next, teach the patient the correct method to use for inhaling the medication from the device. When you are sure the patient is ready, have him administer an actual dose.
Sharp breath in.
Be sure to follow the manufacturer's guidelines regarding how quickly the patient should inhale the medication.
7, 8, 9, 10. Out through pursed lips.
And remind the patient to clean the device after every use.
Always wipe it off with something dry. You don't want it to get wet. Close it up.
Some medications are available in single-dose devices. Be sure the patient knows how to load the medication correctly. Document the patient teaching and the administration of the medication. Remind the patient to rinse his mouth with warm water 2 minutes after using the inhaler. This reduces the risk of developing an oral fungal infection if using a corticosteroid inhaler. Help the patient into a comfortable position.
Okay, it's been about 30 minutes since you took your medicine, so I'm just going to take a listen to your lungs again, okay?
Okay.
As part of your follow-up care, assess the patient's respiration and breath sounds, comparing them with the assessment you made before the medication was administered. Note the patient's response to the medication and observe him for adverse effects.